Okay, why don't you give us your tip of the week?
All right, so today I want to discuss one of the most polarizing drugs in modern medicine. So this medicine actually got its spotlight during the COVID pandemic, but now let's see the newer integrative uses that we see in research. And I'm specifically talking about ivermectin, right? Specifically the emerging mechanistic research about longevity claims, cancer interests, and what the actual evidence currently supports. So my goal here is not advocacy, it's more scientific calibration. So ivermectin became interesting because researchers discovered it affects pathways beyond antiparasitic activity. And again, mechanistically, studies suggest it affects mostly on the pathways of AKT-mTOR, AMPK, PAC1, even mitochondrial signaling, and autophagy and mitophagy. So these are pathways deeply connected to metabolism, inflammation, cancer biology, and even aging. And there are some intriguing longevity findings now, but only in very simple organisms. So the 2018 Rutherford study published Biogerontology showed ivermectin extended mean and median lifespans of approximately 8 to 21%, with some health span improvements, including mobility and mitochondrial activity for these microorganisms. Nematode studies have shown similar lifespans and motility findings at certain doses. But here's the key limitation here that you have to remember. No mammalian lifespan studies yet, no mouse longevity data, and no human anti-aging trials. So unlike rapamycin or urolithin A, ivermectin is not part of a mainstream geroscience yet, but there's some things brewing there. And also another interest is cancer. So cancer is where most of the mechanistic excitement currently exists. In vitro study shows ivermectin can induce apoptosis, inhibit proliferation, reduce angiogenesis, and alter mTOR and ROS-mediated signaling. So the National Cancer Institute, NCI, has explored preclinical work now in this specific area. There's also an ongoing phase 1 and now going into 2 study combining ivermectin with checkpoint inhibitors in metastatic triple negative breast cancers. Additionally, a 26 observational cohort reported self-reported clinical benefit using ivermectin plus mebendazole across mixed cancer populations. But importantly, these are again still in the works and not definitely part of oncological evidence yet. Another striking one would be there's also emerging interest in neurodegenerative disease research. 2025 preclinical study using a streptozotocin-induced Alzheimer's model showing ivermectin reduced amyloid beta plaque burden, neuroinflammation, and pathological brain changes while improving markers of neuronal protection. So researchers believe this may, relate to ivermectin's anti-inflammatory, oxidative stress modulation, and influence on cellular cleanup pathways like autophagy. But importantly, this was again animal models, not a human clinical trial. So while mechanistically intriguing, we are still far from saying ivermectin is an Alzheimer's therapy that we should consider. So interesting, one of the stronger, again, newer applications may actually be malarial transmission control. In 2025, Bohemia trial showed monthly ivermectin administration reduced malaria incidence. So quinine is usually what we use, but now, so it reduced about 26% in children, reduced the malaria incidence. Though, here's the mechanism that's interesting, not by treating malaria directly, but by killing mosquitoes that fed on treated individuals, and which may be one of the strangest pharmacological mechanisms we've discussed in years, making humans temporarily toxic to mosquitoes when they take ivermectin. So conclusion here is the biology of ivermectin is genuinely fascinating, but the enthusiasm is currently ahead of the evidence. And as integrated physicians here, our job is to remain again open-minded without becoming evidence indifferent. So watch out. Ivermectin is kind of getting some traction here. So we'll watch out for that in the future. That's your League of the Week.
Evidence indifferent. Wow. I bet you
What?
yeah, you said evidence indifferent. I mean, what a sort of string there. You
Okay,
uh,
let's bring in some new words to
your
kind
your
of get.
mother would be proud of you, I think. Feels
She
feels
just
like
rolled.
feels like
She
she
just
got her
rolled her
money's worth.
eyes when you said that.
Yeah. Hmm? right? I think your mother. I used to do that with my mother too. I use big words, that really sometimes didn't even mean anything, but
Which
that's
I don't even understand, I
my
guess.
son, the doctor. Right? Okay. And with that, okay, there's a question about the dose of ivermectin where you're talking about that. Remember, they did those studies that, we were using like I don't remember what it was by weight.
Yeah, so with the when you talk about dosing of ivermectin for let's do the FDA approved approach. Parasitic infections are dosed like 150 200 micrograms per kilogram.
Hmm.
And the one that you can remember, the FLCC program, is actually dosing it at zero point 0.4 to zero point 0.6 milligram per kilogram. So it's considered that the high doses are actually falling to that FLCC category. But you have to remember the FLCC program is only going to be giving the patient like 5 days straight, 7 days straight, not like it's an everyday type of thing that we're hearing in specific protocols out there. And as you can compare to the parasitic dosing, it's very different. So parasitic dosing, again, you will just take that what again 1 to 3 days, the most a week and again, it's definitely low dose intermittent use. So for the studies that you were asking about, so the studies specifically for the Alzheimer's, so these are huge doses, 2 milligram per kilogram. Alzheimer's, I think 3 milligram per kilogram, and the same for I think for the other studies, it ranges from 2 to 3 milligram per kilogram. So it's a very high dose, and you have to remember that also, when you talk about the side effects of ivermectin, it's usually GI side effects. But if you go higher, neurological side effects and liver uh, side effects can also happen. That's why this is still, if you notice, these are not human studies for sure. But it's just seeing that the potential of ivermectin is out there once you now kind of get into the weeds of doing it in clinical trials.
Okay.
May I ask what are the neurological side effects of ivermectin? I used to take 1 milligram. I used to take 2 milligrams per kilogram one day, and I was, what are
Uh-huh.
the side effects? Neurological. What can happen if you take a high dose?
So what they're talking about there is neuropathies. And again, they noted these side effects when you're taking really like high doses in non-intermittent fashion. So meaning you're taking it for a long period of time, like months. Not just a month. We're talking about 3, 4 months using high specific doses. But overall, the safety profile of ivermectin is very good. Rarely would you see a lot of these I guess side effects when you're taking it. You always hear about these COVID protocols, right? That's usually where we use it. But again, rarely is it being seen out there clinically.
Thank you. Thank you.
All right. And with that, we move along to Dr. Chris Meletis and Dr. Swathi. You're gonna pronounce your last name for us, Dr. Swathi, and as I'm saying that right, by the way.
Yeah, so it's Dr. Swathi Varanasi is
Okay.
my name.
I got that East Coast accent that I can't get rid of. So even though I've been out here for 12 years. Um, Dr. Meletis has been with us a number of times. He's always contributes something new and exciting and fresh, and he's brought a colleague along now. And you know what? I'm going to let you, Chris, why don't you just introduce yourself? He's written 7 zillion books and 400 million articles. And just we could spend all night just on your credential, on your both of your credentials. So, Chris, I'm going to let you take it away.
Well, thank you very much. And as always, great to visit with like-minded folks and love growing and love learning and great information on the ivermectin. So I've been a naturopathic physician here in Oregon, primary care with a DEA number and all that kind of trappings for 33 plus years. I have written several books. I think I'm up to my 19th book, a couple hundred national articles, and was the dean and chief medical officer of the oldest naturopathic university in North America. So I can officially say I was institutionalized. I have the privilege of having Dr. Swathi. Dr. Swathi is a colleague, and she's a PharmD, so she brings that rigor. So I'm going to go over the 100,000 foot view, a little bit of the details, and then she's going to dive into some of the research. There will be a slide where I have a little video. If for some reason that video, as I announce the video, doesn't work, someone can shout out, and I'll just pass by it. So we're going to talk about ashwagandha, we're going to talk about berberine, we're going to talk about turmeric, we're going to talk about technology. And as we were just talking about with ivermectin, well, what about a dosage? How many milligrams? It better comes down to, as we all know, bioavailability. Is there a way to get enhanced bioavailability beyond a standardized extract? And the answer you'll find today is yes. You can get enhanced bioavailability beyond a standardized extract without a phytosome, without a micellized form. And it's very interesting. When I first saw this technology, I was amazed. So, of course, we know the benefits of ashwagandha, and I'm going to give ashwagandha as kind of our little flagship discussion here. And we know it's great for its adaptogenic properties, has immunological benefits, antioxidant properties. But now, maybe if we can get a larger effect with a smaller dose, could that offer a versatility in terms of application, whether it be gummies, whether it be liquids, or whether it be in a combination formula? And or, as we were just talking about, a pharmacological, if you're trying to get so many milligrams per kilogram, might it offer a better way to do it, but without actually having to increase the milligrams? So research shows a 12x, 16x, 18x improvement with the technology we're going to discuss today. So there's pharmacological studies and pharmacokinetic studies. The ashwagandha study is interesting. They did a randomized double-blind crossover study of 16 individuals, and they saw a phenomenal change in the Cmax, area under the curve. And what's intriguing about that, as you can see in the blue, is here's a dose, the same kind of dose for each individual. One of the substances have been exposed to an acoustic resonance, a frequency, which seems very esoteric. And as Dr. Clearfield was speaking to, we all have to keep open-minded. So when I started hearing about this technology, I'm going, well, I'm intrigued. So a frequency, well, we know about the therapies of music. We know that if you listen to Mozart, for example, you're actually more likely to have less allergenic response to latex than if you listen to Beethoven. Well, that's music, but there's a frequency there. And of course, we know about tuning forks. We know about Tibetan singing bowls onwards. So I started getting very, very intrigued. So what they found here, as you can see in the blue, is the ashwagandha that's been exposed to the acoustic resonance. And it had an 18-fold higher bioavailability than a standardized ashwagandha. Interesting. And make resonance time of 4.1 times longer. So not only did it peak higher, it stayed in the body longer. We all know about dosing. We know about patient compliance, about is it QD, BID, TID, and heaven forbid we ever ask a patient to do QID, compliance goes down, unless it's for a finite period of time, like an antibiotic or something. So, but if we want somebody to be on something long-term, dosing does matter. Number of pills matters. And so patient compliance improves. But also, as you can see, the bioavailability increases, and as well as the duration after a single dose. And Dr. Swathi will go a lot more into the science of that and some of the study nuances. So as you can see here, they have ashwagandha. It's called QA for Quantum Ayurveda. And I'll speak a little bit more about the founder and visionary in a little while. The ashwagandha is standardized 2.5%. So we have a 2.5%, and we have a 2.5% exposed to the acoustic resonance. And then that acoustic resonance, that frequency, and think of Lewis structures, we'll chat about it in a little bit. How do you describe a molecular structure? It has the same chemistry, but if you have three different measures of a molecule, Lewis structures, you have a better description of that molecule than if you only had a single resonance of that molecule. And that's just basic chemistry that we all got exposed to. So you can see at baseline, of course, below quantifiable levels. And then immediately within a quarter of an hour, they had a 12.5 for the Quantum Ayurveda, where the other individuals with a standardized extract of ashwagandha, it's not just like a plain ashwagandha, it's only 2.1. And you can start seeing it climbs incrementally, and it crescendos here at the 2.5-hour mark. But it stays at 30 all the way at the 16-hour mark, as you can see here. You can see where my cursor is. It's like, wow, that's remarkable. It's actually at the 16-hour mark higher than the peak of the standardized extract. So once again, the versatility of a unique formulation. And if you're into formulation, or people that do formulating, you're going to find this fascinating. In clinical practice, it's like, wow, I'm staying at a peak level compared to a normal standardized amount for basically the duration of the entire day. So it was compelling when I started looking at this research. And so the key here with the quantum Ayurveda, and I've kind of captured it all here with the QA at the end, marked higher peaks, comparable peak time to peak, much more rapid, superior overall exposure, 18-fold higher systemic exposure, prolonged half-life, and a 4.1 time longer duration within the body. So you can imagine if we had a med, and all of a sudden, if we were in a pharmaceutical world, and we can have a med that was not toxic and actually went ahead and allowed for a single dose. And think of a Z-Pak. Why are Z-Paks so popular? Azithromycin. It's like 2 pills the first day, 1 pill thereafter until gone. Compliance goes remarkably up if you, of course, it's the correct antibiotic for the microbiology we're going after, the microbiome, bacteria. So it's kind of like interesting. So here's that research, and that's for ashwagandha. Well, we have the same research for berberine. We have the same research also for turmeric. And what they've done is they've looked for a frequency for each of these plants that improve their bioavailability. And there's some 7,000 Ayurvedic herbs, and they're going through the whole index of all these herbs and looking to see which ones can they add a resonant energy to. And is it a panacea? No. Is it some magic sauce? The answer is no. They're finding some herbs take the frequency and retain that frequency in a crystalline state for a protracted period of time. Other herbs just don't want to take the frequencies that are being imparted. So it's not like they're just saying, okay, all these herbs now have got exposed to this frequency. Certain ones get exposed and they have this change per the research on the bioavailability. So it's always with a laboratory and a supplement company, you're looking for the certificate of analysis. And if you see here where that arrow is, it's a little small, but I'll read it to you. They call it radiation. It's not radiation, it's a frequency. But the frequency exposure was 80 megahertz to 1 gigahertz. And that's a proprietary frequency in which they're using. And they're exposing the, once again, standardized extract of 2.54%. So that's some of the science behind what did they test. And they compared it before and after the acoustic resonance. So once again, can you imagine if we were to do that to maybe the pharmaceutical we were talking about earlier? And instead of saying 150 milligrams a day or 200 milligrams a day for a neurological problem, you're able to offer a smaller dose. It's more cost effective, and once again, offers greater versatility and potentially less side effects. So when we look at the curcumin, the ashwagandha, and the berberine, their flagship products, I like to look at the research. I'm saying, wow, okay, well, what is it telling me? And so we're seeing here substantial higher peak levels across the board on all of them. So once again, these are the ones that have taken on the acoustic resonance and are actually been documented to actually have a remarkable increased bioavailability. And you can see this under the reduced dose down here. So the curcumin, 16x more bioavailability, the ashwagandha, 18x, and the berberine. And once again, what do we think? We think blood sugars. We think all these other applications. But when I first learned in 1992, when I graduated as a naturopathic physician, we were using Oregon grape, later known as Mahonia, for its antibacterial properties. So once again, it's kind of interesting. Can I get more? And I can tell you, Oregon grape, if you never tasted an Oregon grape tincture or powder, it's terrible tasting. And ashwagandha has a tendency to be a little bit on the bitter side too. So we're seeing all these increases in exposure. And once again, I'm not going over the detail here because Dr. Swathi will do it, but you can see significantly increased total systemic exposure, prolonged half-life, reduced dose. So now we had a formula. Let's say we were going for the ashwagandha. So we're going to do some rhodiola and some ginseng. And we have some ashwagandha. Now we can fit it all into one capsule because we're going to take less milligrams to get a standard dose, and we'll still exceed it because it's 18 times more. So the therapeutics are there because it has that longer trajectory for being in the body. And so once again, faster results. So the ashwagandha, once again, I'm using it as the flagship discussion point, higher area under the curve, increased Cmax, longer half-life, allowing the same therapy at a lower dose. That's the key, lower dose. And or if we really want to move it, let's say we got an adrenal insufficient patient, we're giving them some hydrocortisone, we're doing other things to help their adrenal function. And it's like, okay, well, we really want to rise Lazarus from the dead, so to speak. Could a higher, longer dose be helpful? And with all our chronically fatigued and or long COVID patients for that matter. You know, it's like if they can remember to take their pills once or twice a day with their brain fog and all their other things, once again, we're going to have increased patient results and outcomes. So as we look here at the formulation strategies, the higher Cmax, the higher amount under the curve, the key really here is that we're able to deliver things in a synergistic manner, but it's also cutting edge. We always like to learn about the new thing, whether it be controversial or whether it be not. And so how does this come about? And it'll be interesting because the Dr. Shafi, which is the gentleman that founded this company, he pondered, because he's from India, he was pondering, how did our traditional medicine come around? And what was the rituals of those traditional medicines? And if we think of all the cultures around the world, has there not always been, with rare exception, music involved, chanting involved, or possibly even a Tibetan singing bowl involved? Yes, I have one of those. And so it's like, so what about frequencies? And we all hear the saying, you get my vibe? And so ultimately this physics that he's applying has to do with dual wave concepts that Einstein and Schrodinger were discussing back in the day. Then they've came up with a couple of combination formulas which are designed for specific targeted outcomes. This one's for neurological neuropathies. And so they actually, this is in trial, so it's not completed yet, but current preliminary research shows that there's a 1.7 times higher improvement compared to B12. They're using B12 as a placebo. They're not using a placebo. They're using B12 as a placebo. And as you can see in it, it has beta-glucan, some alpha-lipoic acid, some magnesium thiamine, the B12, and methylene tetrahydrofolate. And they're seeing that we're having an improved aspect of outcomes and decreased nerve pain. How many patients have diabetic neuropathy or disc issues, secondary to manipulation or not, secondary to lifting too heavy or not, or just a degeneration of us all being like cave people sitting in our chairs too long? And so they're seeing a positive change in oxidative stress markers, quality of life improvement, and overall less suffering. So they have a nerve product that they came up with. And their portfolio, their offerings are not that broad because it's taken a lot of years. He started doing this research back in 2005, and they've continued going ahead and delineating and making sure each one of the products will retain its acoustic resonance long term, so that there's not a shelf life of the energy being degraded over a course of time. Then it created a female targeted product for hormonal modulation, inflammation, metabolic health, bone and joint health. And they looked at the clinical trials. And once again, this is still in process. It's a double-blind crossover study. And they're looking for what's changing. Well, their mood and stress improved, but not statistically confirmed yet. Important. Potential menopausal symptoms. Once again, we may be familiar with the herbal called Remifemin out of Germany way back in the day. Remifemin had been used for 40, 50 years and is a very unique black cohosh extract. But once again, hot flashes, night sweats, and menopausal symptoms are very real. So right now they're seeing some improvement in joint health, as well as the menopausal symptoms and mood, but they need to look longer. But these are upcoming studies. But really the point of our presentation today is to show you the technology, show you this burgeoning area, which one day will probably be a mainstay in medicine. And this is pioneering without a question. So their approach, and they call it quantum Ayurveda, is they take a GMP extract, then they use AI technology, and they're working with pharmacist Amit, and Amit has an AI genie technology, which can be used for not just quantum Ayurveda, but any medicine or drug or herbal you're trying to deliver to the marketplace. It's the same technology they use for pharma delivery to accelerate the patents, accelerate the outcomes. And they do CAD validation, and they use Raman spectrum baseline fingerprint. We'll talk more about that. We'll talk more about the energy chambers, and we'll talk about the Raman confirmation post loads. Once they put the frequency in, they're measuring to ensure that it retains that frequency for a long extended period of time. And of course, they are doing clinical trials. They've done the berberine, they've done the curcumin, and they've done the ashwagandha, and now they're completing these two combo products as well. So of course, GMP extracted, and this Nutrified Genie, Amit, which offers this technology, is not part of the Green Space company, but he's a pharmacist in this realm and an acquaintance of Shafi. So they're collaborating on accelerating the process, because once again, they're indexing and putting a library together of all 7,000 Ayurvedic herbs, and it's going to, in a human, it's going to take forever. So they're actually using some AI to help identify which herbs are more likely based on their biochemistry and structures to take on the acoustic resonance. The computer-aided drug design, once again, same thing. They're using it, and whether we call a medicine like metformin, is metformin a drug? Yeah, I have to write a prescription for it. I can't just go to a US, North American pharmacy to pick it up unless I'm in Mexico, of course, which is also North America, but US, Canada, you can't just pick up metformin any place. But Gallico officinae, which is a source of metformin, clearly you can. But now imagine being able to use that technology to figure out which botanicals can actually be made into higher therapeutic outcomes. So they're using both the AI, Genie, as well as the CAD. And then they're using Raman spectrometry. I'll be honest, I did not know that much about Raman spectrometry, but it actually captures unique frequency signatures of a given ingredient and looks at vibrational energy shifts at a molecular level. I know all about mass spec, I know about chromatography, but I did not know about Raman at any meaningful level until I started looking at this research. And the spectra fingerprint reveals the structure, the chemistry, the quantum vibrational patterns. So think more like when we were in organic chemistry class, or when nuclear magnetic resonance was being used to see, is there a substance there? It's very intriguing technology. But it's the quantum chambers, which is the magic sauce. And it's that quantum chambers that which actually impart the frequency and gently imparts a shift in the molecule. It does not change the structure of the molecule itself. It's still 2.5% active, let's say, in the case of the ashwagandha. But what it is doing is it's showing that it actually can impart the ability to alter and lessen reactive oxygen species, lessen inflammatory markers like nuclear factor kappa beta, cyclooxygenase 2, lipoxygenase. And they've used an outside third party to Rhineland to assess this and to ensure that there's an outside source looking to say, is there the rigor being met? Is there the global compliance being met? And the answer is yes. So this is a gentleman back in 2005, we call him Shafi, and I met him back in I think it was maybe January of this year. Dr. Swathi's worked with him and educated for him for a little bit longer, so she can share more about this. But he comes from an engineering, chemistry, and integrative medicine mindset. And he was the one saying, how did Ayurveda come around? So imagine the same thing about classical Chinese medicine or traditional Chinese medicine or shamanism or whatever the medicine is. Whoever thought of this? And why did they think of it? But one of the things you notice is there was always a chanting associated with it. And was that energy being imparted? So he started looking to see, is there energy being imparted? Call it intent, but at a physiological physics level, is there a change? And of course, we know the answer is yes, and the physics now delineates that quite clearly. So I'm going to play a video on the next one. It's only 3 minutes long. If it's not working, please let somebody shout out for me.
A mortar sings, hands move, breath matches mantra. Rhythm wasn't decoration, it was method. We carry that forward. The chant becomes a controlled frequency, the cadence a reproducible process. What elders called energizing, we now guide with measured vibration, bringing the extract into order so the body can use it well. What if a herbal extract could be tuned? First, we expose the extract to our proprietary frequency. Microscopic structures polarize and align. Random becomes ordered. the spring. Nudge it, and it holds a promise, energy that wants to return. The more the bend, the more it holds. Next, we crystallize the extract. In a crystal, each part has a tiny home. Under a tuned field, that point shifts a minute distance, like a ball nudged up a bowl, creating a gentle preload, a spring held just off-center. Chemistry stays the same. The structure is organized and lightly tensioned. Inside the lattice, vibrations travel as tiny waves, phonons. The materials set notes. Our bodies run on patterns, pH, enzymes, transport. We tune our energizing step toward those conditions, so at the right environment, the extract releases and goes to work. By shaping structure, stability, and release, we aim to make it easier to absorb, supporting natural antioxidant defenses. When the body uses more of what you take, a smaller serving can feel enough. Quantum Ayurveda, ancient rhythm, modern method. From chaos to tune.
So interesting, needless to say. And they've also done research, and we can speak to it at another time. They've actually, NASA has identified certain frequencies for certain organs. And some of us are familiar with frequency medicine, some of us are familiar with PMF maths and all of the above. But now take this to this level of botanical. I chose a random structure here, but the best Lewis structure is a hybrid of the three resonant forms. And so the question is, they gave the example of a spring, but what happens if we have an example of what is the best frequency or tone for a given botanical? And maybe it's boswellia, maybe it's ginkgo, maybe it's some other plant, but each one will have its unique happy place as a spring, not oversprung, but not undersprung. And I found it fascinating. And many of us remember when we were taking physics to get to our terminal degrees in undergraduate, we learned about sine waves and that current, and when there is that ongoing constant wave action, we of course have a bigger wave. And there's two ways to get there's three ways to get your feet wet walking on the beach. You're walking along with somebody, they can push you in the water. That's one. Two, lots of little waves out in the ocean or big waves can stack up and they'll wash upon the shore. And so it's like, so is it one big wave or lots of little waves? And so this is working on the concept, and this is my perception. This is how Chris's mind looked at this technology. It's like, okay, it's like wave action. It's like they're washing up upon the shore. And if we can go ahead and see that washing up the shore, the same amount of water, but with the right timing, it's going to go up the shore a lot longer and a lot further. So this was kind of little Chris having enjoyed time at the beach. It kind of got me thinking about how could I look at this from a perspective and share it with my patients. So now the Raman technology and the spectrometry, they impart the acoustic energy loading, and they do that at a certain stage. They precisely measure whether the ingredient's molecular lattice has successfully stored the energy. They identify the specific frequency. Once again, reproducibility is key here. And then they keep that frequency for that particular botanical. And this step ensures reproducibility and stability. And they're measuring these peak levels along the way. And what's intriguing is what they're not finding is as intriguing as what they are finding. Noteworthy, there's no deterioration and no change in the structure itself. But there's also no degradation bands around the 17 to 1750 wavelength for the carboxyl groups. And there's no broad changes in the 32 to 3500 wavelength, typical for a breakdown, indicating that there's been a breaking of the curcumin bone. So we're talking about tumor here, obviously. So it's interesting to see that the shift is occurring, but they're looking to ensure the plant does not biotransform into something else, because then all of a sudden it's not going to be curcumin, it's going to be some other structure, but it maintains its structural integrity, and they're looking for certain areas where they could otherwise have a change in the molecular structure. So they've been doing clinical trials. And once again, the ashwagandha, and Dr. Swathi will speak very well to this as a PharmD. They've done the ashwagandha, they've done the berberine, they've done the turmeric. And now they're doing these 2 trials on the combination, the nerve product and the female balancing product, for lack of a better descriptor. And the key here is to look for the reproducibility. How does it work? And then they're looking for the fingerprint. They're looking for something called an optical magnetic test, such as a magnetophotoluminescence and the photoluminescence lifetime. How long does the signal last? And then the electroparamagnetic resonance. And this is their identification that it has imprinted. And then in the blue, you can see that it's actually been tracked to alter not only reactive oxygen species, but also help with the mitochondrial membrane potential. Just like we have a cellular membrane potential, we have a mitochondrial membrane potential, and then the intracellular photoluminescence uptake. So they're looking at all of this in structure very methodically. They're not racing any place to deliver more products. And that actually is one of the things that caught my attention. They could just say, okay, well, we've energized all these products and look at all these products we have. No, they're going methodical. They're ensuring that each step of the way, they're doing it in a very methodical fashion. Remembering this all started back in 2005. So it's been a long, arduous process of love and intention. And the other thing is they're looking to ensure not only GMP and ISO compliance, but it's halal, it's kosher, it meets the standards for India as well relative to Ayurveda and the community. And so it's well thought out, and I'm intrigued. I have not yet been able to use it in clinical practice. I'm waiting to start using it for myself and some of my patients, because how many adrenal patients do I have? A lot. How many long COVID patients? I have more than I ever imagined I would have. And it's a whole nother talk for another presentation. And I've presented before on long COVID, but it's like, there's a massive quantity of people suffering from long COVID. There's a sheer number of people that are suffering from ongoing chronic fatigue syndrome, the Epstein-Barr virus, cytomegalovirus, all these other herpes 6 viruses, and just worn out adrenal glands, which of course alter steroidogenesis. And of course, we all remember that the mitochondria is where cholesterol enters, makes pregnenolone, which starts all of, once again, steroidogenesis, that upstream, downstream, and once again, back to the mitochondria. So taking care of the mitochondria is intriguing. And one of the things I'm hoping to see with some of this research is more research with the quantum Ayurveda and the mitochondria. And just a recap, we all remember that which hormone directly has a receptor at the mitochondrial membrane level? T3. So think when we're measuring our free T3 levels, if that free T3 is subpar, then the mitochondria is not being driven. And of course, between the ultra, basically metronome, the thyroid, the orchestra leader, and then the mitochondria that fuels those orders, it's like you can see how these come together. So when I start seeing changes in mitochondrial function, I start thinking PQQ, I start thinking NAD support, and I start thinking things like that, in CoQ10 and pyroquinone and quinone. And so like, it's intriguing to see these combinations. So what they're looking at here is the raw ingredient, and it's a non-conventional energy these frequencies are using. They're using Helmholtz coils and a Schumann resonance of 7.83 hertz radio frequency wavelengths in the mega and gigahertz format, so not radiation like the C of A said, and low intensity focused ultrasound and pulse electromagnetic fields. And so they're nudging the orbits, they're nudging the hydrogen molecules. So we all remember our octets. Oxygen becomes an octet by bonding to itself. Welcome to oxygen. And we see all these different completing, can you complete me? Of course, that's what we're doing in chemistry. So we're looking to see how do we increase those hydrogen bond networks and dial in a specific frequency. And that's what they're doing. And then they're looking at the subtle things. And then you see here on the right-hand side, what it reveals. So this stage of characterizing the detection phase, they've changed the frequency and molecular resonance. So they're looking for subtle changes in hydrogen bonding, stretching, and bands. Are they tighter or are they looser? They're looking to changes in crystallinity. Does the extract become more amorphous and hence more soluble? So they've actually looked at that crystallinity and once again, solubility. Then they looked at altered melting and transition temperatures, indicating new polymorphs or altered stability, the fingerprint of the region that confirms the conformation changes. And then they're looking at the nanometer scale bending or folding of the phytochemical backbone. But thus far, 12x, 16x, 18x for those 3 herbs we mentioned earlier. It's like fairly remarkable, needless to say. If we were to do this, like I said, with a drug, it's like, wow, $1 billion company here. So the question is, and they're always concerned about this because they want to make sure that they stay safe. Because if we impart an energy, are we staying safe? So did the treated extract gain stronger biological activity? Is the intestinal absorption improvement? Do the Keiko studies on this? And does the new form survive gastric conditions and reach target tissues? So that's part of the clinical trials. Tahira, one of the head researchers, has done the study. I'm sorry for the poor res. I can get you all of this information and more if you're interested, because I look at our group, your group, which I'm honored to be part of. So I say our group. You're thinkers. You're wondering what's next. And we all know that we stand on the backs of the men and women that came before us that also asked that same question. What about? So this is a what about question. What about this technology? So what about, as we were discussing earlier with Dr. Nario, what about? May it or may it not? We don't know. But we have to ask the what about, opposed to just being told we have to put our blinders on. And that's what I love about your group. You're expansive thinkers. So we see the attributes of the resonance-informed extract, substantially higher peak plasma levels across the board. And once again, we're seeing the same thing with the nerve as well as female product, significant area under the curve, prolonged half-life, reduced dosing. And that reduced dosing says, hey, I can now do a liquid. So what happens if you try to get a kid to take something? Well, they can't swallow. And I have adults that literally cannot swallow capsules. And I learned that the hard way. A woman I met back in 1993, 1 year after I graduated, was having digestive problems. I suggested, well, why don't you go ahead and take a digestive enzyme? I had no idea. She never told me. I never thought about it as a new doc. She does not swallow capsules. So she opened up the beta-H cell and proteolytic enzymes, swallowed at the end of her meal, and her esophagus started hurting. Yeah, because they're proteolytic enzymes. They start digesting you if they're not digesting meat or other substances. Lo and behold. So, but imagine, why does a Flintstone vitamin or another gummy vitamin have such low milligram doses of things? Because you can't deliver the payload because these things don't taste very good. Minerals don't taste good. B vitamins don't taste good. And a lot of herbs do not taste good. They're by nature taste like dirt. And no disrespect to herbs, but they aren't always so good. And so it's like, wow, can you imagine a very small dose? Now you can be in a gummy. And it still has a huge therapeutic effect, not in terms of the peak level, but also the duration. Because even at a smaller level, it's going to still have that protracted period of time one would expect. And so they're looking to tune, verify, prove, and match. And the logic becomes clear that they're looking at de-risking each step of the way. Because the last thing they want to do is cause harm. They want to be true to the Ayurvedic tradition and history and augment it. So we don't have somebody chanting and parting intention. We can pray over our food. We can wish somebody blessings, but we don't have somebody say, here, let this medicine be good for you, unless you're a very mindful person. But if you can have that mindfulness imparted via a frequency, much like if you had a person from 3,000 years ago doing Ayurvedic medicine for you or one of your ancestors, it's like, wow, could that medicine have been stronger than our current medicine? That's just a plastic bottle shipped overseas with who knows what? Of course. Once again, the delivery mechanism. And I think I still remember, even though my mom's passed, her chocolate chip cookies. There's nothing like the love of mom's chocolate chip cookies. Was there something special about them? But her recipe was a generic recipe, was out of a Betty Crocker cookbook. I think you can taste the love. So the question is, can you taste intent or vibration? So once again, the fingerprints, the tracking of the frequencies, and from a reproducibility perspective, they are finding the reproducibility very clear, very simple, and long-term. And they've not seen any degradation over years of this imparted frequency. And that's one of the questions I had. It's like, so how long is it good for? Like a day, a week, a month, years? This frequency, because of the crystalline structure, it maintains it in stability, and it has extended shelf life as well. They've done the accelerated shelf lives that, if you're familiar with pharmaceuticals and nutraceuticals, they'll say, okay, we're going to expose it to this much heat, this much exposures and noxious substances, and see whether or not it degrades. And it does not degrade. And so I think the key here would be that the frequencies are imparted. And once again, I'm going to have Dr. Swathi speak more clearly to this. But if you look here at the conclusion, the curcumin QA showed more than a 20-fold increased bioavailability in comparison to a standardized curcumin. So it's like, okay, so do I use curcumin in my clinical practice? Yes. Do I use fancy forms of curcumin to cross the blood-brain barrier or a phytosome? Yes. But none of them have this kind of street cred, so to speak. So I'm intrigued to see, does it help with my neurological patients? Does it help with my patients that are trying not to use NSAIDs or not to use a biological drug? Can I lessen their inflammatory sides and improve the quality of life? And so I think what we're going to do here, because some of these look redundant all of a sudden, I'm not sure why, is just speak to the competitive edge. It allows for market differentiation. So if you're a formulator, you know people that are formulated, clearly it's going to be a market differentiation. It allows for gummies, liquids, powder formats, and it requires less masking. The one you sort of have to add in flavors, artificial or natural, and sugars. Once again, not things that we need. It's not going to be physiologically beneficial. And this last weekend, I was listening to a series of lectures at the AAMP, Dr. Paul Anderson's group, and they said, well, what about using black pepper to increase bioavailability? What do you think about that? And he asked a philosophical question, one of the speakers. He says, you know how that works is it's down regulating body's clearance of the botanicals. So he asked the question, if we're using piperine and the black pepper extract to increase augmentation of the bioavailability, well, what happens to the fact that you're poisoning detoxification pathways and other pathways, all for the benefit of increased bioavailability? I never thought of that. If I had learned nothing out of the lecture, I learned lots of things out of the 3 days of lectures. Like, wow, think about it. If we're closing out a pathway in order to increase bioavailability and there's deleterious effects, and that violates do no harm. So lots of C of A's in showing the documentation of each step of the way of the various botanicals. They also do have botanicals which have not yet been energized with acoustic resonance. So they have a wide variety of other high quality Ayurvedic herbs, but the ones we've highlighted are the ones that are really cutting edge and really the difference. The QA, the quantum Ayurveda versus the status quo. They have the clinical trials, quantity, less quantity, greater bioavailability, a more full spectrum whole plant, and the technology is advancing the duration of the, I'll call it medication drug in the body, and it allows the body and the cells have increased accessibility. So Shafi Ahmed is the one on the right in the blue. He is the pharmacist with Nutrify today. They're different individuals, different companies, but they've collaborated to advance the medicine. And of course, it takes a team to win. And so some of the team members showing, once again, how can they deliver this in an efficient, reproducible fashion. So I'm going to turn it over to Dr. Swati, a colleague of mine, super brilliant, and she might actually share with you, and I'm going to encourage you to, that she was awarded the first residency and in what, Dr. Swati?
In integrative medicine and preventative health in the US, specifically for pharmacists. So actually, when I was in my training in pharmacy school, I realized I wanted to be a part of the preventative health and integrative medicine conversation. Of course, there were platforms and programs and everything already for naturopathic physicians, for conventional physicians, allopathic physicians, but there was no program at that point for pharmacists. And so I sought out a mentor, and we actually created the first ever and still only integrative health focused residency program that is targeted to pharmacists interested in creating a pathway in this field. So yeah, so I had the pleasure of helping to create that program, but also be the first resident. So very passionate about integrative medicine, and so happy to be here today to continue the conversation about quantum Ayurveda and continue from where Dr. Meletis left off. So as an integrative pharmacist, I'm very interested in botanical innovation on the whole. And, when I first started learning about quantum Ayurveda through Shafi, through Dr. Amit, through everyone at Green Space Herbs, I knew that I wanted to be a part of this because, like you, I love thinking about what's next and thinking about how I can be a part of that. And at the end of the day, how can we better improve patient outcomes, right? At the end of the day, that's the goal. So as healthcare providers, we know that patients are already using botanical products. I mean, the global botanical market is projected to exceed 500 billion by 2030. Honestly, I think it could be higher than that. And, especially as we're thinking about botanical products, curcumin, ashwagandha, berberine, a lot of these botanicals are used in the context of stress, metabolic health, inflammation, healthy aging, and just overall resilience. And so, consumers and clinicians are increasingly thinking about how we can measure accuracy and efficacy of these products. And, before the conversation was more around, has this botanical been used and like how has it been used? But now the question is becoming, how is it measurable, reproducible, and how can these products actually be clinically meaningful for patients? So, one of the major limitations with so many of the botanicals out there right now is the bioavailability. And actually, Dr. Meletis talked a little to that already. And, some compounds that might look promising and like in vitro and like traditional use, they have potential, but also they have poor solubility, they have rapid metabolism, or they could even have limited systemic exposure after, being ingested orally. So this matters clinically because a patient can take a product consistently, but only a small amount of the active component may actually be reaching the systemic circulation, whether that is in a gummy format, oral, or otherwise. So improving absorption and systemic exposure is not only, a product development issue, it's also like an issue that is going to impact, how these products are working overall. And so I think this is why we need a new framework to think about evaluating botanicals. And I think Ayurveda and quantum Ayurveda are a part of that. Next slide. All right, and so diving a little bit deeper into Ayurveda, some of you might know a little bit about this, but I wanted to give a little bit more context for those who are maybe a little, new to understanding what Ayurveda is. So Ayurveda is a traditional medical system that is from India and it's thousands of years old. And the word Ayurveda is actually translated from Sanskrit to mean the science of life. And what's important here is to know that Ayurveda has, always viewed health from a whole person lens or perspective. And it considers everything from like digestion, metabolism, constitution, even like stress response, sleep, environment, mind body balance, so many of these different aspects. And for healthcare providers like us, this is relevant because so many of our patients do not experience, health concerns in isolated categories because, stress affects sleep and sleep affects metabolism, and metabolism can then impact inflammation, and inflammation, impacts energy and resilience, and it's all just an ongoing cycle. And so this systems-based perspective is one of the reasons why botanicals remain so clinically interesting, because many botanicals don't actually work in the body as like a single target pharmaceutical. And we'll talk a little bit more about that because there are multiple compounds in a botanical and therefore they have a multitude of impacts on the body. So the purpose of this conversation is not to replace the modern evidence with traditional concepts. It's actually to talk about how these traditional botanical systems and systems like Ayurveda from this whole person approach can then be impacted through modern tools, including pharmacokinetics and spectroscopy and some of the things that Dr. Meletis touched on. All right, next slide. Great. So diving into Ayurveda a little bit more, I wanted to talk about one of the core principles called doshas. So in Ayurveda, there are three primary doshas, Vata, Pitta, and Kapha. And these are traditionally understood as kind of like regulatory patterns in the body. Vata is associated with movement, communication, and nervous system activity. Pitta is associated with metabolism, oftentimes transformation and also enzymatic processes. And kapha is oftentimes associated with stability and structure and resilience. And so the key takeaway here is that we do not need to practice Ayurveda in a traditional way to understand the framework. It's more important to think about how Ayurveda has, long recognized individual variability. And so much of what we're talking about, not only today, but in like the forefront and innovation of integrative medicine is about how we need to think about personalizing therapies and how different people may respond differently to the same food or herb or stressor or intervention. And so this concept is highly aligned with how we now discuss, these systems biology, genomics, metabolism, like microbe science, all of these things, and how we can really relate it to the person. All right, so a little bit about energetic mapping in traditional medicine. So Dr. Meletis mentioned this briefly. Traditional systems such as Ayurveda and traditional Chinese medicine, they also use this language of energy. So in Ayurveda, this is often described as prana, and in traditional Chinese medicine, it's described as qi. So for many clinicians, this language can feel kind of abstract, but there really is a bridge to modern biology because human physiology is not purely chemical. It's also electrochemical and biophysical. And cells rely on membrane potentials and iron gradients and mitochondrial electron transport and protein conformational changes and electron signaling. So, while traditional systems and modern science use different terminology, I think we can agree that, both recognize the biological function really does depend on movement and signaling and energy transfer and balance. And to me, that is one of the bridges to quantum Ayurveda because this framework is looking at, energetic, vibrational, and conformational states of change within the botanical matrix and how, we measure that, how we verify that, and how we could potentially look at that and its optimization can really impact what that means for a patient. All right, next slide. Yep. So, thinking about it from a pharmacist perspective, I think that this is where the conversation becomes really interesting because we're not thinking about this just as like a single target. So much of my pharmacy, education was about, okay, how do we look at pharmacology from the single target perspective? And then how do we actually, in my residency and a lot of the work I've done since is really thinking about bridging that to the systems-based approach. And so, much of the conventional pharmacology is built on this model, one molecule, one target, single outcome. And so that model is useful in, pharmaceutical development, but botanicals behave differently. A botanical extract can include dozens or even hundreds of constituents that can influence multiple pathways at once. A classic example of this is St. John's wort, which has been studied, in comparison to SSRIs in mild to moderate depression. And the point is not to compare, or substitute therapies casually. The point is that botanicals often operate in a broader network and this broader network has effects that can impact a number of things like neurotransmitter signaling and inflammatory pathways and neuroendocrine activity and lots of other things as well. So, this means that we need a broader evaluation model or framework. The question is, not only, okay, what is the active compound, but it's rather, how does this full botanical system behave in the body? And so this comes back to, ADME or, absorption, metabolism, systemic exposure, and also the patient response. All right, so now thinking about, whole plant synergy versus the isolated actives. So this is taking this exact concept and bringing it to a bigger scale. So, this is where it really becomes clinically relevant because in many botanical products, the focus is on the one standardized active compound, as I mentioned. So for like, if we're going to use, curcuminoids in curcumin, for example, there are, there are with the withanolides within the ashwagandha, there's berberine contact within berberine extracts. But, standardization is so valuable, as Dr. Meletis mentioned, with some of the technology that Green Space is utilizing with all of the residents and everything, because we need this consistency consistency. And, the surrounding botanical matrix that includes, polyphenols and terpenes and alkaloids and other cofactors can all influence the way that these botanicals are functioning within the body. And so, bioavailability is not just determined by the active. The real key takeaway here is that it's not just the ingredient, but rather, how the ingredient is going to function in the body and its physiological impact. All right. So, when we take a look at physiology on a cellular level, biology is dynamic. And so cells function through membrane potentials, ion gradients, mitochondrial signaling, electron transport, and, other things you mentioned before, protein conformational changes. So, a lot of botanical product development has focused primarily on increasing concentration. So, more milligrams, more standardized marker compounds, how do we get more into the body? And those details are helpful, but they don't actually predict necessarily what happens after ingestion. Dr. Meletis also spoke to this as well, that a higher dose does not necessarily mean higher systemic exposure. And, higher systemic exposure also doesn't automatically mean some sort of higher clinical outcome, or even like a more desired clinical outcome. And so this is why pharmacokinetic data is so useful, because pharmacokinetics can actually help us understand after this product is ingested by the patient or is taken in the capacity that it is administered, how much is absorbed, how quickly does it peak, how long can we actually have it, remain measurable? And then, how does that compare to a standardized extract or a placebo? And so, this really brings us to the conversation of quantum Ayurveda. So quantum Ayurveda, as Dr. Meletis mentioned, is a resonance-informed framework for botanical optimization, and it is, a trademark term from this company, Green Space Herbs, and it is looking at a number of these different aspects like AI-supported molecular modeling and Raman spectral fingerprinting, and bringing it all together to take Ayurveda to this next step to really personalize therapies for patients. And really, this framework is, to make the traditionally subtle concept measurable, and to do this through, decades of research that Green Space Herb has been doing. And it's asking whether the botanical's molecular and energetic state can be characterized, whether it can be reproduced, and then what that actually means from a pharmacokinetic standpoint. And then at the end of the day, of course, what does that mean for the patient? So what we're going to do next is dive into some of the studies in more granular detail that have been done from a pharmacokinetic perspective. So the first one is the berberine QA study. So this is the berberine botanical compound, that, you might be familiar with, especially in, conversations around metabolic health and endocrine concerns. So, berberine has been known for bioavailability challenges, as you may or may not know. And so it's great to see, the study that has been done by Green Space Herbs. And in this human pharmacokinetic study, berberine QA was compared to a standard berberine chloride. And as you can see, it was 500 milligrams of the standardized berberine QA from Green Space Herbs and the 500 standard berberine HCl with a 97% percentage. And so this study was randomized, double-blind, and crossover. There was a 7-day washout, and the participants, they received one single dose. So it was a single dose design. And the plasma berberine concentrations were measured through a validated liquid chromatography tandem mass spectroscopy, or I'll just refer to it as LC-MS-MS for the case of this. And really some of the standout aspects of this study is that, the berberine QA had approximately an 18 times higher plasma peak concentration and about a 4 times higher total systemic exposure, and had a faster time to peak and a longer elimination half-life compared to the standard berberine. So, I mean, this suggests that the ingredient achieved meaningfully higher systemic exposure. So, for us as healthcare providers, this is relevant because systemic exposure is one of the important pieces of understanding how the botanical may perform in the body. Of course, like we don't have the, clinical outcomes yet. That's the next step in doing these studies. But to understand that, wow, like this really the Cmax, the AUC, like there were actually so many beneficial impacts just looking from a PK perspective that this is a great jumping off point to continue doing further studies for berberine QA. The next one is the ashwagandha QA study. So this was the second study done by Green Space Herbs. Specifically, ashwagandha has been commonly discussed in the context of, stress, sleep, mood, physical performance, and a number of other conditions. And so in this study, ashwagandha QA was compared to a standard extract that contained 2.5% with phenolides. And the study was also randomized, double-blind, crossover, single dose study, and the plasma total with phenolides were measured with the LCMS-MS. The ashwagandha QA demonstrated that there was approximately a 5.6 times higher plasma peak concentration and approximately 18 times higher total systemic exposure. Dr. Meletis showed that incredible graph that came from this study earlier in his chat, where you could see the drastic change and the drastic difference rather between the ashwagandha QA and the standardized extract. And also the ashwagandha QA showed a longer elimination half-life and longer mean residence time. So interestingly, the time to peak was actually similar, which suggests that the difference may relate more to the total exposure and retention rather than simply just a faster absorption. And a pharmacokinetic profile like this one that shows, higher, more sustained systemic exposure can help us inform how we think about dosing and consistency and how we can incorporate an ingredient like this to really have the better, the more desirable patient outcome. So of course, the pharmacokinetic data should be interpreted as this first layer of evidence. And once we have more information about the clinical outcomes associated, I think that this particular ingredient in the way that the technology has really been incorporated really can have amazing impacts in the way that we're thinking about using ashwagandha for therapeutic impact. And the final one that we'll talk about today is the curcumin QA study. So curcumin, as you probably know, is one of the most widely recognized botanicals. And especially in this study, we were able to see the impact of how this technology really has, the potential to be really a marker in the space. So, in this study, curcumin QA was compared to a 95% standard curcuminoid extract, and participants received a single dose 500 milligram oral administration under non-fasted conditions, which is useful because I think it reflects actually a more real-world supplement use pattern versus a fasted condition. And the plasma total curcuminoids were measured over 24 hours. The curcumin QA showed approximately a 20-fold higher total systemic exposure by AUC and approximately a 22-fold higher peak concentration compared with the standard extract. So, not only did it, reach the peak plasma levels faster with detectable levels appearing after 15 to 30 minutes, it also showed this total systemic exposure and the higher peak concentration. So, again, this is not claiming a clinical outcome, but I think it's really meaningful to talk about this preliminary pharmacokinetic evidence showing that this ingredient behaved differently in the body than a standard extract. So what these pharmacokinetic, findings mean. So when we look across berberine, ashwagandha QA, berberine QA, curcumin QA, we see a consistent pattern that each of these quantum Ayurveda ingredients from green space herbs really did demonstrate a higher systemic exposure when compared to just the standardized extract that is out there and in so many other formulas. And for healthcare providers like us, this is important because it reinforces that not all botanical extracts are interchangeable. It shows why, the label of the dose can be misleading, but also it's not the be all end all story of like whether or not a dose is going to be a great fit for a patient for a specific therapeutic indication or condition. And it also highlights the value of pharmacokinetic data when evaluating, how we're going to think about botanical ingredients. And it also like helps us have a more evidence-informed way to discuss botanical performance within patients and within different formulas. So, clinically it is nuanced, and now we're asking questions more aligned to like what amount actually reaches systemic circulation, for how long, and why does this really matter, and what is it actually going to mean? So these results do matter to you, and they can also matter to your patients because, these findings demonstrate that, like reading labels, comparing products, all of these things are really important. And, it's our role to help patients understand what the right product is for them, but also how the right ingredients can really fit into their full, comprehensive treatment regimen. And quantum Ayurveda brings together traditional botanical knowledge, modern analytical chemistry, this AI supported molecular modeling, and then the Raman informed verification, and also like putting it together with this pharmacokinetic research, I think is really compelling. And it really is that first next best step to figuring out, what sort of ingredients are going to, really make an impact in botanical formulas. So to close, we really thank you for your time. Dr. Meletis and I have had the pleasure of working with Green Space Herbs for quite a while now, and we've really enjoyed learning about this research. And we're very interested in innovation and trying to understand what's new, what's next. And so it's great to share this kind of information with like-minded folks like all of you. So if you'd like to learn more about Green Space Herbs, definitely reach out to our colleague Greg, who's the head of North American sales. His email and phone number are at the bottom of the screen. And also Dr. Meletis and I are happy to stay on and answer any additional questions you might have about anything that we shared today.
Certainly. Thank you, Dr. Swathi.
Thank you, Dr. Swathi and Dr. Meletis. So I know you sort of covered this, but could you reiterate again, if you're increasing the availability of these substances, don't you run into situations where the doses that at least we're used to are become toxic if they're that much more available?
And I'll speak to that, and clearly Dr. Swathi as a PharmD can. I think that's where we adjust the doses. I think this the graph that catches my attention is when less is more. And so if we look over here at the area under the curve, way up here someplace, and all my blabbering, it's like, I think I would, as a clinician, and of course we all are clinicians, it's this longer duration that catches my attention. So would I go as high? Possibly not. The other thing is, since there's other actives in some of these plants, that sometimes when you get a large enough dose of anything, it's an irritant to the GI tract. And so I would probably lower the dose, many X-fold, but I'm also counting on the long-term duration myself. So, but yes, I think you have to be aware of, is there a pharmacological toxicity? So Dr. Swathi, thoughts?
Yeah, absolutely. I was going to say the same thing. It's more of like thinking about how long it's going to be sustained in the body and what that means. And then, of course, as a pharmacist, I'm also thinking about what other products, whether it's like pharmaceutical products, like the medications themselves, what other botanicals, what other minerals, like what other supplements that the patient is taking, and taking that like whole person approach to understand like what sort of dose would actually make the best sense to just really optimize the risk versus benefit ratio.
And I'll add that both, I think all of us are very aware of drug, nutrient, and botanical nutrient and interactions, and both Dr. Swathi and I have done work in that area. So when you can do a smaller quantity, you potentially have a better received substance with less deleterious interactions, would be my argument.
Have you run across anything where you have higher availability and a higher dose has different, you get different properties than from lower availability and lower dose? And I always go back to naltrexone and low dose naltrexone. And then we've been seeing quite a few patients with the post-finasteride syndrome. I don't know if you're familiar with that.
Oh yeah.
The patients that take the 1 milligram seem to have worse effects than those that have to take the 5 milligram. They seem to have worse outcomes and more frequently this post-finasteride syndrome. And of course, when it first started bubbling up, we'd say, oh, that doesn't matter. That doesn't make any sense. But why would they have more side effects at 1 milligram than at 5? And again, a lot of times we'll for our autoimmune patients, we use a lot of low dose naltrexone, and I have a handout. They have to make sure that they, because they'll just look up naltrexone and they'll see, like, so I'm not an alcoholic. What did you give me this for? Have you run into that with these, with these more, these more concentrated, higher availabilities, even at lower doses?
Not in a clinical setting yet, but I like to go to what Dr. Swathi spoke about, cell physiology and membrane potential. Everything in our body is such a finite amount of something. We're talking about millivoltage. We're talking about so much sodium, so much magnesium. We do RBC magnesium, RBC zincs. I think this is where this technology could apply really nicely, where we give an infinitesimally small amount, but with the right resonance, that actually is better received. But I'll speak to have Dr. Swathi speak to it. And I use a lot of low dose naltrexone in my practice as well. Okay. Dr. Swathi, do you have any thoughts about what Dr. Clearfield was asking?
No, I think it's a fair point. It's just at this time we don't have any additional information from the clinical setting, though. However, I do think it will be interesting to follow up once we have the clinical data from the compound products that the Green Space Herbs is doing the clinical studies right now. And then the next step after these pharmacokinetic studies is Green Space Herbs is looking to do the clinical outcome studies based on now that they have the pharmacokinetic data. So once we have more information, I'd love to share, but I don't have any concrete info at the time.
And when we do, we'd love to come back and share it, because we're also watching the burgeoning field. And since this is a new revolutionary technology, like I said, they're going very systematic and methodical of doing the Keiko studies, doing the kinetic studies, and then ensuring all of that.
So are these products available?
The product is available, just entering the United States in the last couple of months. So it's available.
How expensive are they versus, the regular curcumin?
Quite affordable. Right now, there's a couple of very large nutraceutical companies that we're familiar with in the full script space, looking to bring them on. At this juncture, they're not in bottled form; they're in large bulk form in the United States. So it's going to be manufactured. And
I'd have to cook them up in my basement then, right?
You could. Could. And or spend all your spare time encapsulating them with love.
I was going to say that sounds like a job for Dr. Nario. So, we're at the point now where we need those glasses. So, not like these young people here, right?
But
okay, Nario, do you have any questions online?
Yeah. So that was a good presentation. I didn't realize they could integrate AI now to Ayurveda too. But so the one of the questions here would be, of course, as you were saying, that the lower doses of these specific, I guess, botanicals actually still reaches a higher bioavailability, thus getting your clinical response that you wanted to get.
Mhm.
So that's amplified. Does it mean also in terms of side effects that is also amplified? So, like for example, berberine, right? We don't want that to be taken for a long time because it kills the microbiome, as said. I haven't seen that before, but if you take it for a longer period of time. But it sounds like you accentuate the positives. Would you accentuate the negatives as well with this technology?
Yet to be determined. I would love to, and I'm going to encourage them to do a microbiome study with the berberine to see whether or not there's an alteration. Just like I find curcumin, turmeric at times a little irritating for my sensitive GI patients. It's just too much for them. So I think what I'm seeing as the hope here is much smaller doses in a much more deliverable fashion. And I like the longer prolonged half-life and mean residence time because it allows for better compliance and better physiological response to have an anti-inflammatory and adaptogenic over an extended period of time. So I'm hoping that the folks that are going to be manufacturing this into available supplements opposed to bulk powder are going to be taking that into consideration. And I'm sure Dr. Swathi and I are going to offer our insights to those formulators.
Yeah, absolutely. I mean, that was my first question when I heard about the outcomes also of the PK studies was, so what does that mean about side effects? So I'm just as intrigued to hear the answer and see the outcome after the clinical studies. And we'll keep you in the loop once we know.
Oh, for sure.
Right. I think it's just a question that came from the perspective of a double-edged sword. You get all the pluses, but there's sometimes there will be a catch to this. But again, I hope not. I hope I'm wrong. AI does wonderful things, and it seems like this device that you got really is interesting. It's almost like it reminds me of homeopathy, but not homeopathy. Is
Yep.
that you're transferring sound waves, but for homeopathy, you do succussion and dilution, and you get the smallest dose that you need for the body to get stimulated to make it function in a physiological way to repair itself. But again, it's definitely not homeopathy, but there's some similarities to it. So anyway, it's just fascinating to me. Another question here. So you you put out all the studies that you had, and these are all showing clinical outcomes in terms of the drug qualities, the area under the curves, right? But are there studies that are showing now the clinical outcomes for patients if these specific remedies have achieved the curcumin, NF-kappa B, turmeric necrosis alpha, um, those type of specific parameters? Have you gotten that far yet, or this is too early of a question for these specific products?
That's the next step is large human clinical trials. The most advanced ones are the female Heal QA as well as a Nervithera QA, where they're actually doing clinical trials and endpoints to see how does it improve with nerve pain or how does it help with hormonal and mental and musculoskeletal well-being. So they've already are getting the other studies in the queue, so to speak, and to hear one of the head scientists over there actually have several projects in the works to answer exactly those questions.
All right. Well, those are the questions that I have. So good job.
And they're great questions. And they're the same questions Dr. Swathi and I have too as clinicians.
Yeah. Everybody's curious about this, especially when you won't go wrong when you put the AI word out there and include it in a specific product. You're just gonna get all the interest in the world. So this is definitely something that's very, very interesting as you move forward with this project.
Could I ask a question?
Go ahead, Josh.
Go ahead, Joe.
Well, okay. I like yoga, meditation, Eastern philosophy. Ayurveda is fascinating. And I think in this presentation where you talk about quantum and the scientific approach. You're bringing Ayurveda to a new level. You're talking about modern science, and it's very exciting. Well, my teacher, Dr. Mishra, he called Sanskrit the science of vibration. And traditionally, when you read the Ayurvedic text, they say the rishis performed samyama on the plants, which is a deep meditation, and rishis were like holy men, and that's how they got the knowledge. Now, what's interesting about Ayurveda, you also have bhasmas, which are special Ayurvedic ashes, and sometimes they involve metals, whatever, right? And I have online a series of videos called Fire Ceremony and Crystal Healing. And I was, my Dr. Mishra used to open people's third eye by doing, homa ceremony, Agnihotra, where you chant over cow dung and ghee, or you can use cotton. He would take the sacred ash and put it on people's third eye and open it. So is quantum related to Shaktipat? And that's where the gurus do a very spiritual transmission. And, there's another book that a German pharmacist wrote where they take the sacred ash of Vibhuti and they have reported cancer cures. So Dr. Dayton used to do electrodermal testing with the bone machine. So you have the nadis in yoga, and you have the meridians in acupuncture. They kind of equivocate, and you could take the bone machine and say, is a pharmaceutical going to work? Is a herb going to work? Or is a homeopathic remedy going to work? And he said, sometimes you get spectacular results. So I said, why don't you write a book about it? Because it says, he told me it takes over 10 years to learn. So I was going to say, Dr. Renasi, I mean, your last name is the sacred city of Benares, where they say if you pass away there, you die there, you're liberated. And then what Dr. Mishra used to teach is he used to say the Yoga Sutras are already within us. And that, well, I kind of believe that Sanskrit has a life of its own. So it's mystically very fascinating. And, there's validity to mysticism. And I think by taking a scientific approach, we give people a newer and better paradigm. And I know of a couple Ayurveda schools. One is Alandi Ashram, where Alakananda Ma is the main teacher. And she was a DO in the UK before she got into yoga. And then Anthony James has a school in Florida. And he is on our Saturday Zoom group where we work, and, Dr. Clearfield knows about them, where we work on helping veterans and Native American Indians. So I think, in a sense, with all these wonderful Zoom groups, there's a think tank. And the think tank is opening people's eyes and learning about new modalities. So that's very exciting. So that's my 2 cents.
Well, it's worth more than 2 cents, and thank you. And yeah, actually, if you ever have within yourself or members in your group as part of the think tank want to be introduced to the team over in India, we'll be more than glad to make that introduction.
Of course, we want, give me your contact information, or I'll get it from Dr. Clearfield. And we invite you to see me on our Monday group.
Sounds good.
Okay.
Yeah.
And maybe the Saturday group too, we can talk to them. And Dr. John Burgess, he's been to the Golden Temple and he can tell you all about meditation and Shaktipat.
Yeah, I did my Ayurveda in the Himalayas, so I'm a little old, man. Hey, but I really wanted to let our esteemed group speakers tonight. It was most appreciated. And if you didn't know it, we do have a subset of research that's under Bill's nonprofit. So we all work together, but we have a specific research, ethical research group. And two of those members are not me, but two of the members are astounding. And one is Dr. Quinn, who has established a universal apothecary as a compounding pharmacist, and he wants to know the truth. So it makes it very simple, very simple. And then we also have another genius dude who's helping us out, Dr. Tano, who has developed the AI and the digital platform through which we can do our research. And we would love to welcome you to join us because what Dr. Tano and Dr. Quinn have done has never been done before. And we would be happy to use your products to get some honest answers. Thank you.
Wonderful, thank you. And well, definitely, Dr. Clearfield, if you make that introduction as well, I'll forward it also, not only for Dr. Swathi, we're interested, but we'll also forward it to the team in India, because we're as a collective trying to advance the betterment and health of humanity. And part of that is taking away the barriers.
Only in this last week, we have had one of the prize Indian surgeons who is definitely a young genius, one of those guys in India. So he was through medical school when he was about 20 years old. Now he's a phenomenal orthopedic surgeon, and he has joined our research group. So the ability for us to tie in with India should be easy, especially with you helping us out. We've always done the Ayurveda since 1980 at our hospital in India. So, everybody's open for that.
Well, Honor, thank you for the invite and thank you for your openness. Very, very kind.
Thank you.
Thank you.
It's refreshing, yeah.
Okay, anybody else have any comments or questions?
So in our Andrew Weil program, we were studying also the dosha typing. And as I always hear about dosha, I kind of mentioned about that, Dr. Swati, a while ago. In relation to these remedies, or maybe if AI can get into the mix, is there a way to personalize these therapies or these botanicals to specific individuals? I mean, this is just kind of like a far out question, but I just kind of correlated everything when I remembered my readings.
Yeah, it's a great question. And actually I don't know if you're learning from Amita Nathwani, but I actually helped her with a clinical study at the Andrew Weil Center with her patient population. So I'm very familiar with the Andrew Weil Center and the Ayurveda programming and stuff there, which is amazing.
Oh.
Yeah, so okay, great question. At the moment, the way that they're looking at the resonance mapping and everything is it's not necessarily specific to each human, but rather thinking about how we can broad scale actually influence the resonance mapping of each herb for its sustained exposure and impact. So they're not actually looking at it at like kind of a personalized, individualized level. But I think that could be potentially something that they consider for the future, or maybe even thinking about, because most people, what I didn't mention in the initial discussion is that most people have like a primary dosha, and so they're not like monodoshic, so you're not like full 100% pitta or something, that you actually are generally like a pitta vata combination, and then everyone has like also the third one as well. So I do think that down the road, that is something that they would consider. But I think that for the way they're thinking about optimizing the botanicals right now, they're thinking about it as a bit more broad scale, rather than like 3 or 4 or 7 different kinds.
So basically more focused on the botanicals rather than
Yes,
the ones who's
exactly.
going to be using the herbs.
Yes. Mm-hmm.
Oh, gotcha.
I think is ripe for the research. And it'll be interesting within a subgroup if there are high responders and low responders, because we're seeing the net area under the curve. whether that was specific to a specific dosha, you know, presentation. So I think that asks a bigger question of if they came in prescribed with a certain dosha composition or constitution, does that alter the way that these herbs respond with them? I think it'll be very easy to do a subset of the data and then, you know, do a post hoc study on that. Great question. Good thinking. In fact, I'm writing it down.
Yeah, more ideas for you guys, more assignments, right?
Cool. Well,
Okay.
thank you.
Okay. Well, all right. Thank you, Dr. Meletis. Thank you, Dr. Swathi. It's a pleasure as always. And anybody have anything else? Anything left? We had nothing in the chat on our end here. So you answered every question. Okay.
Well, thank you all. And thank you for the invites. Thank you, Dr. Burgess and Mr. Stein as well for the invites and the information. So I think we'll love to make some cyber introductions and some collaborative ventures. Okay.
Okay. Great. All right. Anybody have any? So I will be at IFM next week. I'm actually presenting there. So I'm sort of like a foreigner there. I'm not really, part of their group. And the person who invited me, and he'd only been there a month, and apparently they fired him. So I don't know what that means exactly. He's the one who brought me on, and they're very picky about how their slides work. I don't know if anybody else is. They've been giving me. They've been giving me agita, it's 10 days away, and it's still not, this color isn't right and that color isn't right. And so the guy, like I said, the guy who said, okay, we want you to present, and I'll help you get, do it the way they want it done. I didn't hear from him for a few days. Then I got an email that he got fired. So he wasn't there 3 months. So,
and they are particular. I've done their male and hormone, thyroid, and adrenal hormone modules, and they are very particular. But they're going to love you, because you're going to be a fresher breath of air for them, because they're regimented in their thinking, but they're expansive in their desire.
Well,
so you're going to grow them.
I took a couple of the modules, and they asked me what I thought, and I said, well, the first thing is, after a year, you shut it off. I paid you a lot of money. Why are you shutting it off? Right. So, so you can buy another one, I guess. So anyway, so we have that coming up. I have that coming up. And how about you, Dr. Nario? And what's doing at A4M?
We'll be having our women's hormones again on, I think, October. But my coming talk would be in June, and that'll be in the Philippines. It's one of the medical centers there that is starting an integrative medicine clinic, or they already started. It's one of the bigger ones. It's called Medical City. So that's going to be online. But yeah, it's going to be October. That's my next one in April.
You were supposed to go to Dubai. What happened with that? Did that
until the war came?
So... Yeah, that's what I figured, because I didn't hear anything more about it.
I don't want to be dodging missiles, so no. I think we'll do that some other time for now.
All right. Okay. If anybody else out there, is speaking anywhere, and or presenting anything? No. Okay. All right. Yeah. Oh, by the way, also I'm doing AMNG has me doing in their certification course now. I'm doing a assessment of the age management patient. So putting that together. And in their fall in October, I'm going to be doing an 8-hour laboratory workshop, laboratory of functional medicine, from serum all the way to, we haven't decided all the exotic tests they want to present. So I'll need a chiropractor there or somebody, because my back won't hold up for 8 hours. I know that. So,
Dr. Clearfield,
8 hours.
Yeah.
Here, okay. Is there a protocol for angina?
Protocol for what?
Angina.
I usually call you, Shell. So.
I know what to ago.
Yeah. Well, IFM seems to like to create that. So, and it's not like I haven't been presented before. So, but whatever. All the lettering has to be white, right? I like making slides that have a little color and a little bit of character to them. Nope, no good. They have to be all white.
Yep.
So okay, it's their show, I guess. So
give them multimedia slides.
Yeah, I don't know. This will be the first time I was ever one of their things live. I've only done some online things, and
no, they'll probably love it.
They will.
I did one of the hormone courses. I didn't come across you, Dr. Meletis, but like I said, they redo them every 2 years, and they turn it off. So
yeah, I did a 2015-16, but then they wanted to do it in Colorado, and I am not a high altitude person. I get altitude sick in a heartbeat, and so once they chose that, I opted out.
Okay. All right. Okay. All right, everybody. So so that's what's going on around here. Next week we have Jeremy Mumphrey, who was the editor of the the weekly health magazine for A4M, and he's going to be talking about Lyme disease, syphilis, and Morgellons. Did I say that?
Oh, Jeremy, yeah. Morgellons, yeah.
Yeah. Did I say that right? Yep. And that's good. And so that's next week. Bring your friends, bring your enemies, give us a call, let us know what you're up to. We always need speakers, and come across anybody that you might find interesting, let us know. Shell, thank you for all your help. Dr. Nario, thank you for your help. And Dr. Meletis and Dr. Swathi, we can't thank you enough for your time and your effort. And of course, we'll be annoying you again, Dr. Meletis, probably in 3 or 4 months. So we don't want to overwhelm you, but we are here every week. Tuesday, you're in Oregon, Tuesday, 5 p.m. We are here every week, and you're always welcome to sit in, listen, and throw in your 2 cents.
Wonderful.
Okay.
Well, thank you all.
Okay, thank you all. Thank you, Dr. Swathi. I will send you the video when it's ready, and I will send you the participant list if you want to get in touch with the folks that were here. Okay?
Sounds great. Thank you.
All right. Good night, everybody. Have a great week.
Good night.